Yeah, there's a little over 100 that I saw signed up. Should I shut this door?
Good morning, everyone, and thank you for attending the 2020 Behavioral Health Symposium. We are happy to host this event as a virtual conference because we care about your health and safety, but we also understand how important it is to provide relevant and robust continuing education to Louisiana healthcare professionals. For quality purposes, all participants will be muted during the presentation. If you would like to submit a question to the speaker, please use the Q&A feature in the virtual platform. This session is a
I'm Brad Leger, and I'm an educator from Esterwood, Louisiana. That's in Acadia Parish. I really wish that we could all be in one room together, but I'm confident that all will go very well today. And I hope that you and yours are safe and healthy amidst this double whammy of COVID and Hurricane Laura. Since this topic is so important as well as being complex, each slide that we'll be looking at today could be its own workshop or even degree program. I'd also like for this to be a reflective time for you, both personally and professionally. I look forward to the Q&A at the end of the presentation. As well as understand you'll be able to post questions and comments in the messaging feature during my presentation. So we'll do our best to keep up with them. I know Ms. Coletta will do a fine job with that. There will also be times when I will pose questions and situations to you for your consideration and invite you to post your responses in the chat feature. I also realize that there are probably many experts on this topic in attendance today, so please feel free to share your expertise with the rest of us. So we have much to cover, so let's get rolling. So again, my official financial disclosure slide. So again, I think you have seen the objectives before to this presentation. Of course, all this revolves around ways in which health professionals can hopefully create communities of culturally competent individuals who are developing a sense of commitment and inclusivity toward LGBTQ persons, thus providing care in an ethical manner, especially during this pandemic. We will certainly be covering more information than this, but these are some of the highlights. So you should have been presented a poll for this presentation here. I'd just like to know a little bit about you. So please take a minute to answer these questions and respond. And if you're with other people at your location, these would be some good items for discussion for you. So again, what is your profession? Why are you here? And identify an experience, positive or negative, you have had with LGBTQ people in or out of your professional realm. So I will give you a couple of minutes, and Ms. Coletta will be waiting for some responses. I see some responses coming up here. Okay, could you read them out, please? Mm-hmm.
So we have Gina Lewis, who's a social worker.
Okay, social workers.
Wonder Kelly, nurse.
Nursing.
CSOC coordinator.
CSOC coordinator.
LPC.
An LPC, very good. I presented a lot in front of LPCs and social workers before.
School psychologist.
Mm-hmm. School psychologists.
Nurse director.
Nursing.
Medical social worker.
Medical social work. Okay, so that's a good cross-section of what we have. And what about the next question? Why are you here? What are some of the responses, Ms. Coletta?
Still getting those coming.
Okay. We'll do a few of them.
We have a participant that is interested in this topic.
Okay, participants are just very interested in this topic.
We have participants that sit on the board for an LGBTQ organization.
Ah, someone sits on the board of an LGBTQ organization.
And someone is just interested in learning.
Okay, good. And every time I make this kind of presentation, it's, you know, everybody's all over the place as far as why they're here. Sometimes it's very personal, and sometimes they just want to expand their horizons. So very good. Okay, so what about the third question, the experiences? We'll do 2 or 3 of them.
They're coming.
Okay.
We have an HIV clinic administrator turned full-time researcher.
Okay, so someone who's an HIV clinic director, you said?
Yes.
Okay. And what kind of experiences they've had? Just this is a new experience for them, is what you're saying? Okay. Okay.
I have someone who has struggled with applying client who doesn't identify as either gender and wanted gender neutral pronouns.
So one of the participants said they have worked with a client who is dealing with issues of gender identity and how they wish to be addressed, particularly with pronouns. And we'll cover that in a couple of minutes, in fact. One more, please.
Being a gay man who has been in counseling, my first experience with a therapist was horrible. He was super conservative, and though conversion and prayer were what I needed to no longer be gay.
So one participant who identifies as a gay man had his first experience with a therapist was very, very traumatic and very negative. So anyway, I hope that I'll be able to address some of that with you today as well. I hope that you, whoever has posted this, have been able to work with someone who is more affirming now and help you in your own journey. So thank you for your responses. Okay, so let's move on here. I see that this year's theme speaks of changing the conversation in 2020, and that this will be done through recovering, rebuilding, and rejoicing. The promo for this conference states that as professionals involved in healthcare, we wish to change the conversation with professionals, consumers, family members, peers, and advocates to promote promising and innovative practices in behavioral health and treatment and prevention to 3 points: strengthen our communities, improve outcomes, and change lives. Although I myself am not officially considered to be a member of the healthcare profession in the traditional sense, what I do professionally as an educator and one who works with people in their spiritual development will also ultimately affect the quality of a person's life and perhaps even save it on many levels. So I beg your indulgence to allow me to use the inclusive pronoun we today, since I feel like a member of the family anyway. It takes all of us to help to strengthen our communities and to improve outcomes of our clients with whom we interact and ultimately change lives. Since the theme states that we wish to change the conversation, I guess that it's safe to assume that in viewing other details on the conference website, the conversation that we have been having in the past has perhaps not been going so well in promoting and sustaining a healthy, inclusive society. Of course, this is not only within the healthcare profession, but also within all aspects of society. I know that in my own professional background, much improvement has been made and much more is necessary. We're evolving, you know. Also, as we spend our time together today, as well as when you get back to your regular routines, I ask all to keep in mind, from what are we recovering? What is it that we must rebuild? And for what must we rejoice? In this slide, again, I took from the website conference, I see that some of the answers to my last questions have been answered. Although the needs are many within society when it comes to good health, I've been tasked today to speak specifically of the health and well-being and challenges faced by members of all ages within the LGBTQ community as we go through this COVID-19 pandemic. As you probably know, members of this population, of which I happen to be a member, experience tremendous stressors on many levels with regard to their health and social well-being, even without the presence of a viral pandemic. The additional challenges presented by the pandemic only exacerbate this situation, and we'll be discussing this today. Some of us in the community, because of access to good, culturally competent professionals and supportive companions and family, fare better than others who unfortunately do not. So let's take a quick look at this list on this slide and consider the issues faced by the members of the LGBTQ community when it comes to their well-being. For those of you who have worked with members of this community, or if you yourself are a member of this community, what are some of the conditions from which we need to recover? So let's think about that. Which of the actions and experiences listed in this slide help to promote the rebuilding of lives? Which of these indicate a cause to rejoice? So which of these jump out at you? Let's take a minute to ponder these questions. If you feel so persuaded to put them in the chat feature, that's fine. If you feel so inclined, if not, just take notes of this, because of course we'd like to continue the conversation after this presentation and also within your own lives and within your own work. So if any of these come up, Ms. Coletta, just feel free to let me know. And you don't have to put it in the chat, but just I'd like for you to think about it. So it's my aim then to cover some of the main issues today and discuss best practices in working with members of this population. There is unfortunately no possible way to discuss all issues with the time that we have today, but I would be most happy to connect with any of you after this symposium to continue the conversation. If I don't have the answer, I could certainly lead you to some good resources who could. These involve very complex issues. Okay. I don't have any data on this, but I'll bet that the majority of the general population is not even aware of the many official positive ethical stances for LGBT clientele held by professional healthcare provider groups, such as the ones listed on this slide. Excuse me. And to which some of you belong. And this is not a comprehensive list, of course, but I did some research. I guess that for some of you who have been in this profession for some time, you also realize that such a positive stance on the ethics of providing equal access of care to the LGBTQ community has not always been the case, nor has it been clearly and officially articulated. This has ranged from just plain not knowing anything about the issue, to not being on people's radars, to be somewhat aware, and to even outright hostility. Unfortunately, there are still some healthcare professionals out there who refuse to provide adequate, equitable care. And to be fair, healthcare practitioners are not the only group of people who are faced with this issue, of course. Great strides have been made in the professional areas of which I'm a part, that of education, spiritual companionship, and ministry within particular faith traditions. But we all have such a long way to go. So again, for those of you in these associations who have some really good positive policy of dealing with the LGBT population, I applaud you for that. And thank you for your ongoing work. So we need to be laying some groundwork now before we get into the specifics of healthcare. So I'd be remiss if I didn't go briefly into a little detail about the core in what we're striving to grow and evolve, and that is cultural competence. I think about, I've presented several times to social worker groups and other related groups on LGBTQ issues. And I remember in the middle of a presentation one time at a state social workers conference, it was a very large crowd, and in the middle of a small group discussion, one of the participants stood up. She said, you know, just because we're social workers, that doesn't mean we know everything about everything. And I really appreciated those remarks because she was there, like most of you in this crowd today, just have so much more to learn. And she was very appreciative of that opportunity to be able to do it. And she was humble enough to say that. So the same holds true with people in all professions who work with and for other people who are different from them, be it gender, ethnicity, socioeconomic level, and of course, sexual orientation and gender identity. So this makes me feel even more appreciative today that you're here. We're all here to learn together, and I'm still learning. So this is all very significant as we as a society continue to move forward through education, encounter, and reflection to do the right thing in providing appropriate, culturally competent healthcare to all members of society. We all know that in most professions and public and private agencies over the years, including the health profession, it has indeed been a journey of enlightenment and evolution. So as we go through this presentation today, And in the days after this conference, I invite you to think of your own stories of evolution when it comes to being culturally competent. As in dealing with any individual or group of which we are not a part, as health professionals, we must often confront our own prejudices, discomforts, and lack of knowledge, and provide care in an ethical manner. There are so many stories which I can tell about myself in many areas, the times where I just didn't know better about a certain group of which I was not a part. And thank God, through life experience and openness, I'm learning. But for instance, I'm a gay, cisgendered white male. So in overall society, I do have lots of inherent privilege of being a white, older, cisgendered male. However, there is also some serious challenges which I face, having to navigate society differently than a straight, white, cisgendered male does. Having said this, I will never know, for instance, what it is to be an African-American female, or transgender Latinx woman, or an African-American cisgendered male. Therefore, I have to educate myself by study and by encountering African-American females and Latinx transgender women and African-American cisgendered males to learn of their stories and be humble and compassionate enough to learn about their lives, what challenges they face, and what gifts they bring to the table. The characteristics you can see in this chart are a continuum and are not meant to define a system or organization. Rather, they allow systems and organizations to broadly gauge where they are and to plan for positive movement and growth to achieve cultural competence and proficiency. The continuum is dynamic and not intended to be viewed in a linear manner. So we have 2 steps forward, 1 step back. This could be also like in a spiral kind of diagram as well too. Systems and organizations may be at different stages at different times with different populations and cultural groups. Finally, system and organizational capacity is not limited to arrival at cultural competence and proficiency, and there's always room for continued growth. In other words, we never get to the top of the mountain and perfect. We're always learning. You've heard me throw around this acronym a lot so far today. And this terminology is ever evolving, and I'm still having a hard time to keep up with new terminology that deals with sexual orientation and gender identity. But it's important that we all know and use the correct terminology. So again, this acronym is the most inclusive method to work with, again, gender and sexual minorities. And I'll get into the part about the Q part, the queer part, which can be a very difficult term. For the sake of time, I will assume that you are familiar with some of the basic terminology. And I could have a whole workshop just on terminology, and I'd be glad to do that for you or for any of your colleagues at a future date. I will tell you that these terms are ever evolving and new ones are popping up all the time as science and anthropology learn more and as people self-identify. So if you have any questions along the way that you need clarified, please send us a message and Ms. Coletta will help me out on that. I think 3 of the terms that I just want to really get at: transgender. I think a lot of people have a lot of questions about that. It is an umbrella term that we use. It includes all persons who are gender variant. So in other words, those who don't conform to the social expectations about masculine and feminine. So it includes a lot of people. Queer has typically, historically, I'm sure most of you will realize, has been a pejorative term, very oppressive kind of term historically. But over the years, especially within the younger generation of the LGBT population, it has been embraced excuse me, and owned, especially by the younger generation. So instead of being derogatory, they're actually starting to own it. And a lot of people, excuse me, will interchangeably use queer with LGBT. There's even queer theology, there's queer sociology, etc. And then the Q could also talk about questioning. These are people who are really not sure, they're still on their journey about what their orientation or gender identity would be. So this terminology, again, we're just trying to be more and more inclusive, all right? So I will be using the term today, LGBT or LGBTQ. You see, I have the plus after the Q because that adds in all these other terms that we're talking about. But I think it's very important that as professionals, no matter where we're working, in what profession, that to be respectful, we need to use the proper terminology that people referred to as. So I beg you to take a look at this slide right here, especially now, talking about being respectful. And you're seeing more and more how they're starting to identify by their pronouns as well. For instance, I go by he, him, his. Some people, she, her, hers, or some people want to be or to be more inclusive, and they'll be they, them, theirs. So again, the English language is changing, and sometimes it's hard to unwire our brains to use it differently. So again, I'm going to get specifically to the part in a few minutes about COVID, but I think it's really important for us to lay some groundwork here again about stressors for members of this population, even before the pandemic. This is something that we've had historically happening. So let's get a glimpse into the world of LGBTQ folk with regard to how they navigate life, particularly with regard with their sense of well-being. Even prior to the pandemic, LGBTQ persons have been subjected to many layers of stressors on a daily basis, all which adversely affect their health and sense of well-being and safety. Some of these situations could be referred to as, I call them, a slow burn, and others as scorching burns, and others as annihilating burns. So let's take a little time to address some of these issues, and it's important that we begin again with some sort of baseline. Criminalization of persons, this is all over the world. Unfortunately, some of these laws in many countries, and again, these statistics kind of shift a little bit, but these are fairly accurate right here. Some of these laws are either being supported by civic and church leaders, or the leaders are just silent on the issue. It's also interesting that many human beings have a deep revulsion or deep visceral reaction for anyone who does not conform to that particular culture's expectations of gender identity and expression. So woe be to you if you are an effeminate male or a masculine looking or acting woman, or if a male is attracted to another male, etc. This often, unfortunately, leads to violence and even to murder. And so, why is this? I ask you, and you'll see me asking this a lot during our presentation this morning. Why do you think this is? So many layers of meaning for this. Here's another example. This pastor, who is also a member of law enforcement, said that civil authorities should carry out trial and death sentence for homosexuals. Could you imagine being an LGBTQ person or a loved one of an LGBTQ person sitting in the congregation listening to this or seeing this in the news media? So you'll be getting a copy of this presentation, and you'll be able to access the link and see his sermon. And I watched it, and it's frightening and it's disturbing. And again, my intent is not to, just really browbeat faith traditions this morning. I'm part of a faith tradition as well too, but they are part of society, and it's also such prejudices are found in all levels of society. But these are just examples that I pulled up. These LGBTQ activists in Bangladesh were hacked to death by members of a militant religious group in 2016 for being, quote, pioneers of practicing and promoting homosexuality. The group, which claimed responsibility for the murders, called it a, quote, blessed attack. So the guy called Manan was editor of Rupban, which is Bangladesh's first and only LGBTQ magazine. He tried to organize a rainbow rally for LGBT youths on April 14th of that year, the Bengali New Year, but was stopped by the civic officials. His friend was a theater and TV actor who sometimes helped with publishing the magazine. So an AP News report explained Manan had written openly about the frustration of living in the closet. As a gay man in Bangladesh, where homosexual relations are considered a crime. In a May 2014 blog, he said gays and lesbians in Bangladesh experience a country where the predominant religions say you are a sinner, the law of the land says you are a criminal, the social norms say you are a pervert, the culture considers you as imported. Some of you may be aware of violence against the transgender population. So as we look at these stats on this slide, we need to ask ourselves again, why? So much of this deals with societal norms in various cultures, which dictate what is appropriate with regard to gender roles and gender expression. Discrimination and violence against trans women of color is even higher than the white population. So we're talking about the intersectionality of being a person of color whose gender identity and expression do not conform with societal expectations. So it's any wonder then that rates of suicidality in the trans population is also much higher than the general population. Among the starkest findings is that 40% of respondents to this particular survey, these are trans people, have attempted suicide at some time in their life, nearly 9 times the general population. So can we now see how and why most members of the LGBT population live with varying degrees of constant stress? And of course, this has health implications. So these next few slides I've broken down into 3 different age groups. Again, I call them the pre-COVID stressors. And again, these all affect their health. And again, in a few minutes, I'll add on the layer of what COVID has brought. So we're gonna deal with youth, young adults to retirement. So youth, I mean people who are minors who rely on their parents or a family for support. Young adults up to retirement, and then elders. The slides that I will be sharing with you certainly do not present a comprehensive list, but I would like to at least present a few facts to paint a picture for you. As we discuss all of them, I once again ask you to be reflective on your own professional as well as personal experiences and to consider next steps. Looking at this picture also reminds me, and if those of you who are from the Baton Rouge area, it reminds me of the early days of schools attempting to create LGBT affirming or support group organizations on campus, such as gay straight alliances. And so the situation I'm thinking of, I recall when this took place at one of the schools in East Baton Rouge Parish in 2000. There was a huge school and community uproar, which even made the news on the local, state, and national levels for a long time. I mean, it was in Newsweek. The students who wanted to organize it ran into lots of bigotry, fear, threats of violence, and hate from fellow students, non-support from most faculty members, and resistance from the school board. But they were persistent in their efforts and were ultimately successful. Now more GSA, that's Gay Straight Alliance, and they go by different names. Organizations can be found in more schools around the country. This also brings to mind a few years ago, I was asked to speak with a counselor who was located at a public school in Louisiana. And his situation was he had a 10th grader at the time who was perceived to be gay, a young man, and he was being bullied by 3 of his classmates. And so the counselor really had no experience at all or information or to deal with the LGBT population. And so the 3 boys were suspended, but not expelled. And so this young man still had fear going to school, and there was no safe space for him at school. And at the same time, his parents found his diary at home, which revealed that he indeed was gay. So upon them learning this, the counselor told me that began beating their child at home and publicly berating him just because he was gay. And the father worked offshore, so the mother would taunt him and say, well, just wait till your daddy gets back home from offshore. So this young man had no safe space at home, nothing at school, so naturally this was affecting his health, his attendance at school, and his performance at school. Of course, my first question was, have these parents been reported, to the authorities? And they were, and I followed up once on them, and I think they were getting some help with this. But so again, this is something that, again, a lot of young people just have to deal with, unfortunately. And again, when we look at these statistics right here, throughout a lot of slides, you'll see a lot of references to suicidality. So again, this is pretty accurate and recent data as well too. So think about that again, with all the stresses that they have, of course it leads a lot of them to suicidality, and unfortunately some are successful with their attempts. And of course the increased, much higher rate than their peers, their non-LGBT peers, to have substance abuse. Okay, again, to mask the pain, to hide the pain, etc. Now let's talk about a related issue to homelessness. And that's what awaits youth, and even worse for LGBT youth, and even worse, transgender youth. So notice with this data here, I've added the T and the Q to the acronym. We're talking about homelessness, and there are shelters that will take in intact families, of course. However, there are very few shelters specifically set up for LGBT youth. Thus, they're usually mixed in with the general population, and this is where the abuse can occur. Also, many homeless LGBT youth get caught up in sex work in order to eat, right? They just need to find some way of getting money to eat, and unfortunately, they get pulled into that kind of life. And of course, it has its bad consequences. And of course, specifically transgender youth as well, as far as being bullied and harassed at school. The majority of them report some level of being bullied at school. Any questions thus far we could address?
Yes, sir. Can you give an example of non-binary?
An example of non-binary, very good. I'm glad that was brought up because as we know more and more through anthropology and people's lived experiences, this is coming up. Non-binary. Most of us have been programmed, and most of the world historically, it is pretty binary. You have male and you have female. Really nothing in between. But as we know, looking at history, and looking at good data in science now and with experience of people, we have always had people who are somewhere along the continuum. So we talked about transgender people, but also people more and more, in non-binary, it can be under that umbrella as well. But there are some people who don't identify either as totally male or totally female. They're somewhere in between. Some days they feel more masculine and may present more masculine, and other days more female. So it's fluid, and again, it's very challenging to keep up with the new language, and especially a lot of us coming from the younger generation, because the younger generation feels more free to be able to come up with this. And with good science and research, we're finding this out. And again, we have always had people who have been non-binary. So I hope that has answered the question. So there's an example of non-binary. Again, I've worked, I know a lot of different ages of people. It's most of the younger people that they'll dress androgynously, and in their makeup as well too. They prefer to be called they, them, and theirs, which is a challenge because we've been hardwired in our brain, to use pronouns differently. So I hope, and there's no, I think I've just given one example, just the way they dress, the way they present themselves. And some days it may look different from each other. So thank you for those questions. So please let me know if there's some others that come up. Okay, so the next age group, we're gonna go to young adults to retirement. These all deal with negative attitudes, both external and internal. As we consider each bullet, we need to ask why. Again, you hear me saying that a lot. Of course, you're gonna see in these statistics a lot of similarities with the youth statistics, but as you get into adulthood, there's different layers of challenges, and you're taking it kind of at a higher level here in a lot of respects. So these attitudes can lead to rejection by friends and family, discriminatory acts and violence, and laws and policies with negative consequences. And there are issues with going to the doctor. Some people are just really scared to come out to the health professionals. Some health professionals, again, we're talking health professions today, but this could talk about education. We could talk about a lot of professions. Today we're addressing health. But maybe some of the health professionals may not be outright rejecting the patients, and they may have goodwill, they just don't have the cultural competence, they don't have the language, they don't have the knowledge for it. But again, looking at these bullets right here, all of these different policies, legal as well as societal pressures, some just can't stay employed. It adds to their poor mental health and coping skills, etc. And again, more of these stresses right here, it affects their ability to maintain and have good long-term relationships. Sometimes this means them, having trouble with commitments, being maybe promiscuous and such. You're opening yourself up for different STDs, etc. And again, adding to the stress and limited social support. Again, more stressors. Specifically for transgender persons, again, clinical depression, anxiety, the somatization, the smoking, the substance abuse, the suicidality. It's even higher for transgender persons because, and we'll talk a little more specifics in a bit, but transgender persons, of course, are harder to, like we say, pass in society, and they come under much more scrutiny. Lots of homelessness, more sobering statistics right here. I know transgender people who have lost jobs because they came out as transgender in the past. They've been kicked out of their churches. They've been kicked out of their families. They're on their own. They've lost jobs, and so therefore they're really in financial straits. And if they go to homeless shelters, again, a lot of harassment, a lot of danger, or sometimes they're just totally turned away. More transgender situations, again, these overlap with the stats for the LGBT persons, but trans persons even have higher risks. Like going to the doctor, for instance. Again, maybe the doctor is not going to reject them, but if they have not had the opportunity to change their ID for their driver's license, and their picture doesn't conform with how they look now and what names they go by. It can be done in Louisiana now, but it can be very, very difficult for some people. Depends where you live, what part of the state. And just stepping out of their front door every day is a big risk. Since many trans people, particularly those who are born biologically identified as male, at birth and are transitioning to female, it's harder to pass. In other words, it's harder to look totally female like our society says it is. And so they're a target, for brutality, etc. So that can be a very big issue. So let's go to the next age group, and that's our elders. So those are past retirement. What does AARP say, 50 or 55 and above or something? One of the things that, and there's some good research that just came out, and some of y'all might be familiar with it, is the notion of non-conscious bias. That's the activation of negative stereotypes outside the conscious awareness. So this can threaten shared decision-making and perpetuate health disparities among LGBT older adults. For example, a healthcare provider could be working from a stance of understanding of heteronormity and gender normity. This can come across as disrespectful and trigger anxiety for the patient, especially one who has experienced abuse and oppression. Because remember, many LGBT older adults came of age when non-heteronormative behavior was criminalized. I remember a few years ago, I was giving a presentation to a group of social workers, And we were going over terminology, and there was one of our elder statesmen that was sitting in the back of the room, and we're going over terminology. And it was his turn to say the word queer. He couldn't even get it out of his mouth. He was just so horrified, and he was a straight man, as I understand. But he was so horrified just to even say that word because of its negative connotation, you know. So you can imagine all the stressors historically that the elders have had who are gay, lesbian, transgender, bisexual. For many, there were stiff penalties to be incurred, including the possibility of incarceration, violence to one's person, loss of personal freedom, and the ability to support oneself, and the inability to love and befriend whomever one chose. Failure to disclose sexual orientation or gender identity may have adverse health consequences for the LGBT elders, such as a delay in diagnosing a serious medical problem. Thus, they often delay in seeking medical care. So in my own life, with regard to my own health care, for the most part, I've had no problems. When my partner was undergoing chemotherapy for Hodgkin's lymphoma a few years ago, I always accompanied him to the doctor visits and chemo sessions, and we were open about our relationship, and I was put down as his contact, as his partner. We thankfully had no problems, but I know this has not always been the case for gay couples. Thankfully, I'm slowly starting to see positive steps in medical records, which are evolving to be not so heteronormative. That is, when you complete, for example, the section on the names of emergency contacts, and every once in a while we have to update these. There are now spaces with some offices that allow one to list the person as a partner rather than a spouse. I have this information on file with my healthcare providers, and I have fortunately had no negative repercussions. Again, some people have had horrible experiences in the not so distant past, which is why there's often much hesitancy in revealing personal information. So LGBT elders are less likely to seek long-term care services. With a lesser likelihood to have a support network, the elders must often rely on long-term care services. They have no one else to care for them. Whether in-home services or residential care, this research says 60% of LGBT respondents are concerned about discrimination, and 40% are not comfortable being out to their provider. Out means to reveal their orientation or gender identity. For some elders, the fear of discrimination and stigma includes the risk of racial bias. So you have the intersectionality again. If you're a person of color. Compared to white LGBT older people, African-American and Latinx elders have shown greater concern about being treated unfairly in long-term care. I can have a whole workshop on issues dealing with elders entering nursing facilities, which have staff which are not LGBT culturally competent. Add to this, think about it, other residents and their families who are not supportive of LGBT people. This could result in abuse and bullying and non-acceptance by family members of their roommates. Think about that. I don't want my father dealing with, rooming with him, So a lot of times they go back into the closet. They can't reveal who they really are. So again, let's think about what trans elders are really, really at risk, trans and the LGBT as well. Questions?
How can we confront the scourge of conversion therapy in the U.S.?
How can we confront the scourge of the conversion therapy? Let's get this at the end, because I think after we go through the rest of this presentation, it's going to help put some pieces of this puzzle together. But thank you, that is a huge thing, and some of y'all may not be familiar with what conversion therapy is, but let's hold on to that, please. Don't ever forget it. Okay, so now we're to the point of let's talking about our stressors during the pandemic. So as I stated earlier, even prior to the pandemic, LGBT persons have been subjected to many layers of stressors on a daily basis, all which adversely affect their health and sense of well-being and safety. Now, in the midst of this health crisis, there are even more layers of stress and obstacles which account for increased health disparities as compared to their non-LGBT peers. So it's talking about the youth now. So, of course, because of school closings, for instance, there's a decrease in positive social interaction during COVID. So an unintended consequence of physical distancing is a potential loss of the social connections that protect LGBT youth from suicidality. Social connections have been found to buffer stress, reduce depression, and improve well-being. So think also of any important life-saving support groups that they may be attending in or out of school, such as PFLAG, which is parents, friends of parents, friends of lesbian and gays and transgender people. From a developmental perspective, loneliness is especially relevant to youth populations, as the need for social acceptance and belongingness is prominent during adolescence and young adulthood. Although it is too early to fully understand the impact of physical distancing due to COVID-19 on health and mental health, existing research has found that people who do not feel connected to others, interestingly, are more likely to suffer from respiratory illness, report depression and anxiety, and experience suicidality. Among LGBT individuals in particular, connection to the LGBT community has been found to buffer the impact of stigma on depression and suicidality. So again, we have youth who are missing out not only, of course, with the obvious for education, but also there are organizations at the schools, more than not, they're LGBT related, that help them to stay connected and can be a place of support. And another thing too, there are the significant adults at the schools who have helped them many times during crisis, and they're not around. Unemployment can be especially pronounced among the LGBT populations who already experience high rates of unemployment and high rates of suicidality. So, a lot of youth, again, all youth, but particularly the gay youth, LGBT youth, they are on these frontline types of occupations as well that put them at great risk, like working at restaurants, working at grocery stores and such. And LGBT youth are disproportionately impacted by housing instability. So we're talking about minors here who are dependent upon parents and family members for food, clothing, and shelter, and they're often living in a non-supportive, even hostile environment at home, the very place where they're supposed to be loved and nurtured. Even before the spread of coronavirus, these youth are represented twice the overall rate in unstable housing. So again, added stresses again, they can't go anywhere. And so if they live in an unsupportive household, many dangerous problems. So what can we do? It's important that youth and those who support them remember that a physical distancing does not have to equate with social isolation. There's already a thriving online community that allows youth to experience connection. So we have these. Unfortunately, we have some youth who may not have access to Wi-Fi, access to the technology. And I know a lot of school systems and communities are trying so hard to provide that for them as well too. So that's real important. It's just to let them know that they're not alone. Something more long-ranging, of course, is policy changes. Moratoriums on evictions from rent freezes, we're hearing this a lot on the news, can help with that too. Organizations serving the youth should be cognizant of impact housing instability. So we could help, again, that's long range, to change policy. Talking about the young adults now to retirement, why do you think so many members of the population find themselves in these situations? Why are they more vulnerable to the health risks? Because you can see this slide right here, because already they're in poor health, just lacking health coverage. They haven't been seeing doctors because maybe they don't have insurance coverage. They have more habits that affect their health as well too. So makes them more vulnerable. Again, a high rate of them living in poverty. It's also important for us to realize that people who are already depressed or anxious may have worsening of those symptoms. that people have waited sometimes years for gender affirming surgery, let's say, and suddenly to have them canceled due to COVID can worsen their mental states. We know that there's a significantly higher risk of suicide among LGBT folks, and so all of this can exacerbate or worsen the kinds of experiences that people are having. So again, big issues with that. So what can we do? To identify practitioners who are culturally competent. If you're one of them, please offer yourself. If you feel you need some more information, I'm glad that you're here today. And what else can you learn about this as well? Telemedicine is getting more popular for all segments of the population. Again, getting people to the right resources to help them to stay healthy. And practitioners becoming more familiar with the organization's policies. Again, several of y'all have some really good, strong, positive policies work on this population. So that's really good. Get familiar with that. And of course, to become allies. For the elders, again, they've already experienced a lifetime of discrimination. And like I've said before, they've probably just not had the kind of support that they needed. And again, they've historically been so afraid to be out that they're not gonna go and seek medical care as well. They don't need to have the support. And remember, a lot of them have no partners, have no children, and so they're relying on the health system, especially long-term care. And you have the added layers right here. The elders are more likely to experience social isolation. Public health efforts such as social distancing and quarantines are designed to slow the spread of COVID, yet these measures often mean further isolation for the elders. So big issues there too. So what can we do? Again, we're looking at policies from the hospitals and long-term care facilities. Who do the patients, the clients refer to as their chosen family, and are they allowed to visit, which is really important. We do know that we have the Supreme Court just made the decision that you're not supposed to discriminate, which we agree with housing and employment and such based on sexual orientation and identity. But just because we have changed laws doesn't mean we have always changed hearts. And that's something that we can do, again, through cultural competence or for being allies, things like this. So any questions at this point? What I want to do is tell y'all we're running out of time to share some good resources for you. Again, you will have a copy of this PowerPoint. It has these links, and also I have another resource guide with tons of other good resources for you as well. So any other questions besides those? Okay, all right. So let me just show you a few resources. Again, these are for different age groups. Some of you may be familiar with the Trevor Project. It was founded in 1998. And it's a leading national organization providing crisis intervention and suicide prevention services to LGBTQ youth. And again, they had good stuff on their website dealing with COVID. So, and of course, the CDC, tons of information about COVID and specifically about the LGBTQ population as well. And you'll see in my slides that I did get some good information from the CDC. Some of you may be familiar with the Human Rights Campaign. It strives to end discrimination against LGBTQ people. And on their website, again, they have been providing information on dealing with COVID. This is a very reputable ongoing research project that I'm very familiar with. It's called the Family Acceptance Project. It's out of San Francisco State University. It's a research, intervention, and education and policy initiative that works to prevent health and mental health risks for LGBT youth, including suicide, homelessness, drug use, and HIV in the context of their families. And a lot of you, of course, work with families, cultures, and faith communities. So they're a research-based, culturally grounded approach to help ethnically, racially and religiously diverse families learn to support their children. So they talk a lot about best practices. In fact, in their website, they just put it out a few months ago. There are posters that you can download for free. You'll have to print them yourself, but you could post them in your offices and other important places. Dealing with the elders as well. I've been involved a bit with this organization, just attending some of their activities. The national organization is called SAGE. There is a local group based out of New Orleans. They used to be called No Age New Orleans Advocates for GLBT Elders, and now they are part of SAGE. Again, they were formed because LGBT older adults often face discrimination when seeking medical treatment, have a high rate of poverty, etc. The socialization stuff. One of the things that their executive director tries to do also is to work with nursing home facilities, long-term care facilities, to help them to become more culture competent, to give them some training. And unfortunately, it's a very, very hard sell. Most are not interested in getting information from him, and that's not a good thing. Crescent Healthcare, some of y'all might be familiar with that if you're from the New Orleans area. This use they had its origins in the No AIDS Task Force, but it deals not only dealing with HIV and AIDS, now it gives healthcare and physical and mental health care to all members of society, and they are very much working with the LGBT community. In January 2017, I think it was, the National Geographic had a specific issue on gender, just fantastic. And there's also an accompanying video, a documentary that was made. You can get it for free. The link is right here. Excellent, excellent stuff. So we have questions here. I'm going to address the one about conversion therapy. And so, and I'm going to read the question. It is written, how can we confront the scourge of conversion therapy in the US? And I would concur with that word descriptor, scourge. For those of you who are not familiar, conversion therapy is an attempt by different professionals, either religious or people not saying they're religious, they claim they're psychological professionals who are really trying to work with people to change their orientation. In other words, a common thing is child comes out as gay to the parents don't know what to do. They said, no, this is not true, we're gonna change you. This is not really true. So they send them through this counseling, through these camps and things like this. And the APA and the National Social Workers and other different groups have condemned this kind of practice because it is harmful, leads a lot to suicide, to self-harm and things like this. That's a very, very quick answer. So how to confront it? Again, I think it's through education like this, also to work with policymakers, because some states have outlawed it, some have not. I forget the number, maybe 26 states, I'm not sure, have outlawed conversion therapy. There's no safe way, you just can't do it, it's who you are. And the same way with transgender people as well. So how can we confront it? Education, changing policy. And I covered the one on having one more question? Okay.
We post a safe space message in our offices and use pronouns on our website. How else do we make sure to inform the community that we are a safe space for LGBT?
Excellent. Could they hear you when you said that? And I'll just repeat it. So this participant said that they have post a safe space area, right?
Yes.
And what else do they do?
They use pronouns on their website.
Mm-hmm.
How else do we make sure to inform the community that we are a safe space for LGBTQ?
Right, they talk about the proper use of pronouns, preferred pronouns. How else do we let the people know, the public know about this? I think to be very much outright in your communications, to have it on your website, that you're inclusive, that you are respectful of people of different orientations and gender identity, and to have it in your formal policy and let people know about it. For instance, I know National Social Workers, they are very explicit in saying they are affirming. You know, the APA, the AMA, the Nurse Association, I found all these. And so let people know it exists and that this is a safe space. Yes, I think that's the best way to do it. Education encounter, and you know, this is a very complex, difficult conversation to have sometimes, all the time. And so it's important that we become advocates and continue being advocates if you are already. Get educated, etc. So, other questions, ma'am?
Just thanking you for the resources.
Well, thank you. And I thank you, ma'am, for your great assistance today. And sir, thank you for your great technological, Mr. Amos, assistance. It's been such a pleasure being with everyone here today. And again, I'm giving you some resources. I'd be most pleased to meet with interview groups at a later time. If you would like another workshop just like this or something related, I've done all kind of different iterations around this topic. But it's important that we address it. And like Carlotta, Coletta, we were talking earlier today about some, you know, ministers within faith traditions. A lot of them, they just are afraid to address it at all. Or, it can be very negative, and it's not just religious leaders, of course, it's people of all professions. So thank you so much. Enjoy the rest of the conference, and I enjoy communicating with some of you. If you have any questions, check with me on the app, and we could continue the conversation. Thank you so much.